Assalamu alaikum. I am Dr. Leera, Assistant Professor of Biochemistry, Bashundhara Ad-din Medical College. Today we are going to learn about lipid profile. What is lipid profile? A group of laboratory tests are done to assess the lipid status of an individual to know the status of coronary artery disease and atherosclerosis. Basically, we want to know the lipid status of an individual. Is there is any dyslipidemia? What is dyslipidemia? It can be either hypolipidemia or hyperdyslipidemia. What is lipid? First of all, we should know that what is lipid. Lipid are heterogeneous group of compound that are insoluble in water, but soluble in fat solvent like ether, benzene, chloroform. Lipids are classified into three types. These are simple lipid, complex lipid and derived lipid. In simple lipid there is triacylglycerol, complex lipid is phospholipid, glycolipid and lipoprotein. And derived lipids are many, there are many derived lipids. These are steroids, cholesterol, bile salt, bile acid. In lipid profile, we basically test for four lipid status. These are triacylglycerol, we want to know the total cholesterol, HDL cholesterol and LDL cholesterol. HDL and LDL are lipoprotein attached with the cholesterol. HDL is high density lipoprotein and LDL is low density lipoprotein. So, the parameters of lipid profile are triacylglycerol should be less than 150 mg/%, total cholesterol should be between 150 to 200 mg/%, low density lipoprotein cholesterol should be less than 130 mg/%, high density lipoprotein cholesterol must be more than 40 mg/%. HDL cholesterol measure the cholesterol in HDL particles is also called as good cholesterol because it removes the excess cholesterol from our body and it takes it to the liver and causes excretion of this cholesterol. So, HDL cholesterol is good cholesterol. LDL is bad cholesterol cause it causes the lipids to move from the liver to the periphery and causes deposition of this lipid in the inner wall of vascular system, inner wall of the vessels. So, the blood flow, normal blood flow is hampered. So, the organ that is supplied by that blood supply is hampered. In case of heart, in case of heart, when the lipoproteins or lipid are deposited into the coronary artery, it causes less amount of blood flow to the heart and which is result into coronary artery disease or ischemic attack or myocardial infarction. Preparation. For doing the lipid profile, we have to prepare our patient. Usual diet for 3 days before the test. আমরা কখনোই লিপিড প্রোফাইলের আগে সেই পেশেন্টটাকে বলবো না, আগের থেকেই এমন হবে না যে পেশেন্টটা তার রেগুলার যে খাবারটা সে গ্রহণ করতো সেটা কমিয়ে দিল। যেমন আমি যদি কোনো পেশেন্টকে বলি যে আপনার লিপিড প্রোফাইল করা হবে 3 দিন পরে, সে যদি আচ্ছা আগে গরুর মাংস খেত, চিংড়ি খেত, কিন্তু এখন যদি সে এই খাওয়াটাকে বন্ধ করে দেয় তাহলে আমরা নর্মাল একটা লিপিড প্রোফাইল পাবো না। সে নর্মালি যেই খাবার খায় সেটাই খেতে থাকবে। 10 to 12 hours fasting prior to the test. Procedure. Number 1, collect fasting morning blood sample. Blood is taken in a plain test tube and allowed to clot. Number 3, serum is separated and lipid profile components are measured. Objective. What are the objective of this lipid profile? Diagnosis of dyslipidemia. To assess the prognosis of a known dyslipidemic patient, to assess the risk of atherosclerosis and coronary artery disease. Importance. It is important for screening of cardiovascular disease, increase LDL directly related to cardiovascular disease, increase HDL inversely related to cardiovascular disease. এখানে আমরা উদাহরণস্বরূপ বলতে পারি যে একটা পেশেন্টের ট্রাইসাইগ্লিসেরল যদি 140 হয় এবং HDL কোলেস্টেরল যদি LDL কোলেস্টেরল যদি লেস দেন 130 হয় তাহলে সেই পেশেন্টের করোনারি আর্টারি ডিজিজের যে যতটুকু রিস্ক থাকবে একটা পেশেন্টের যদি ট্রাইসাইগ্লিসেরল নরমাল কিন্তু LDL কোলেস্টেরল লেভেল 130 এর বেশি থাকে লাইক 200 অর 250 তার করোনারি আর্টারি ডিজিজের চান্স অনেক বেশি থাকবে। এই জন্য এই লিপিড প্রোফাইলটা করা হয় যে যাতে আমরা সম্পূর্ণ একটা চিত্র পাই একটা পেশেন্টের লিপিডের কি আমাদের শরীরে লিপিডের স্ট্যাটাসটা কিরকম আছে এই সম্পূর্ণ চিত্রটার জন্যই আমরা আসলে লিপিড প্রোফাইলটা করে থাকি। What is dyslipidemia? Dyslipidemia, group of disorder characterized by abnormal either high or low plasma lipoprotein and lipid concentration. What are the causes of dyslipidemia? There is nutritional cause. It includes excess calorie in diet, excess consumption of saturated fat. Endocrine disorder that includes diabetes mellitus, hypothyroidism and Cushing syndrome. Drugs that are involved to do dyslipidemia are steroid, oral contraceptive pill, beta blocker, thiazide diuretics. Number 4, renal disease also causes the dyslipidemia, which includes chronic renal failure or nephrotic syndrome. Hepatic causes are hepatitis and recurrent intrahepatic cholestasis. Others এর মধ্যে obesity, alcohol abuse, SLE, full form systemic lupus erythematosus. These are the causes of dyslipidemia. Hypercholesterolemia. What is hypercholesterolemia? When cholesterol level in blood is more than 220 mg per deciliter level is called hypercholesterolemia. Causes. The causes of hypercholesterolemia is hypothyroidism, nephrotic syndrome, diabetes mellitus, obstructive jaundice, familial hypercholesterolemia. Hypocholesterolemia. When cholesterol level in blood is less than 150 mg per deciliter, it is called hypocholesterolemia. What are the causes of this? Number 1, hypothyroidism, liver cirrhosis, malnutrition, myeloproliferative disorder, chronic anemia. Hypertriglyceridemia. When TAG level in blood is more than 150 mg per deciliter, it is called hypertriglyceridemia. The causes are high carbohydrate diet, high fat diet, diabetes mellitus, obesity, hypothyroidism, nephrotic syndrome, renal failure, excess alcohol consumption, familial hypertriglyceridemia and idiopathic cause. Idiopathic means the cause is still unknown. Triglyceride decrease in A beta lipoproteinemia, malnutrition, recent weight loss, vigorous exercise, drugs. HDL cholesterol decrease in stress, acute MI, stroke, surgery, starvation, diabetes mellitus, hypothyroidism, liver disease and nephrosis. That's all for today. Thank you.